Hello, my name is Dr. Diwan S. Raja. Today I will discuss about the multiple choice questions from the diuretic pharmacology. Our first question is that a group of university students of India tried to climb the peak of the mountain Kanchanjunga and were able to climb an elevation of 3,320 meters above the sea level before sunset. They what they do, they camp for the night to get sleep. About half of them could not sleep despite whole day physical exertion. By the following morning, they presented with nausea, headache, palpitation, weakness, and dyspnea. Which of the following diuretic prophylaxis therapy could prevent those symptoms? So if we go there, okay, try here, you get the lesser pointer. So we have the presentation of acute mountain sickness. The drug of choice is the acetazolamide. It actually decreases the pH of CSF, and it also causes the metabolic acidosis that will lead to life. So it can prevent the cerebral edema and the pulmonary edema. So this is a drug for prophylaxis for the acute mountain syndrome, the acetazolamide, the carbonic anhydrase inhibitor. Okay, we got that. Now we'll go here. Number two, which of the following diuretic have the highest efficacy in mobilizing sodium and chloride from the body? Our answer should be, this is the key point, highest efficacy. So it should be the loop diuretics, the B for boy, the loop diuretics is the diuretics which has the highest efficacy in mobilizing sodium and chloride from the body. Okay. Then number three, a medical student was attending the pharmacology lecture class and was surprised to hear that a diuretic is used to treat nephrogenic diabetes insipidus. The medical student was a little distracted in the lecture hall and could not remember the exact name of the diuretic. Which of the following diuretic is used to treat nephrogenic diabetes insipidus? Okay, our answer should be hydrochlorothiazide. How it works? It actually increases the osmolarity of the urine. It also decreases the plasma volume. So in that way, it works almost paradoxically, and it may decrease the urine output in nephrogenic diabetes insipidus from 13 liters to 3 liters in a day. So this is the drug for the nephrogenic diabetes insipidus. Okay, we got that. Now, our next question, which of the following diuretic can be used in treating idiopathic hypercalciuria and is particularly beneficial for patients with calcium oxalate stones in the urinary tract? Okay, so that is our answer, should be again hydrochlorothiazide. It helps in the absorption of the calcium from the lumen of the nephron, so there will be no calcium oxalate deposition there. There is no stone formation there. So answer should be C, hydrochlorothiazide. Okay, we got that. Now we go to this question number 5. The thick ascending limb of loop of Henle is a of the site of the following, okay, the diuretic. And what is that diuretic? Okay, we'll find out that the thick ascending limb of the loop of Henle is a site of which of the following diuretic? Okay, we'll go there. This is the choice here, should be the ethacrynic acid, C for cat. Okay, so ethacrynic acid, that is the diuretic. Okay, so that work in the thick ascending limb of the loop of Henle. Our next question is, which of the following diuretic is a synthetic steroid and may cause impotence, gynecomastia in male, in female menstrual abnormality or irregularity, and hirsutism. Okay, so we know impotence, that is lack of sustained erection of penis during sexual activity, gynecomastia, enlargement of the male breast. Okay, so because this is a synthetic steroid, this diuretic, so it will work on multiple receptors. Okay, it may cause menstrual abnormality and hirsutism. There is the development of hair in unsightly places, like in female there may be mustache formation or maybe beard formation. That is hirsutism in female. So these are associated with what? The answer should be A, that is the spironolactone. What is spironolactone? Spironolactone is a potassium sparing diuretic. Okay, so that is a synthetic steroid. Acetazolamide is what? Acetazolamide is a this is a carbonic anhydrase inhibitor. Urea is what? Urea is not very much popular, not used too much, but it is a osmotic diuretics. Okay, so like these other drug, they are not the synthetic steroid. Okay, so chlorthalidone is a thiazide like substance, okay, that is not associated with this type of sign symptoms, so like gynecomastia in male, menstrual abnormality, hirsutism. So answer should be here. A is the answer. A is the answer. There is the spironolactone. Okay, we got the answer of this question. Number 6. Number 7, we go there. A 57-year-old male was an aminoglycoside therapy. Okay, aminoglycoside are the group of antibiotic. What are those? These are the gentamicin, amikacin, tobramycin, kanamycin, even the anti-TB drug streptomycin is also one of the aminoglycoside. Okay, so those drugs themselves may cause some type of problem, and if we use this drug along with another diuretic, then some of the toxicity may be even more. His physician added a diuretic in his therapy because this person has developed pulmonary edema. Okay, within a few days, that patient developed deafness, that is lack of hearing, and this is most likely the sensory neural deafness, that is most likely due to damage to the cochlear nerve. It may also damage the vestibular component of the cranial nerve. Which of the following diuretic may cause ototoxicity, that is the toxicity of the internal ear, the vestibulocochlear nerve or the eighth cranial nerve, when used in conjunction with an aminoglycoside antibiotic. Okay, so our answer should be number 7, that is the loop diuretics. Like what? Like the furosemide. Okay, so furosemide is a good drug for pulmonary edema, but this drug, aminoglycoside, may cause problem in the eighth cranial nerve or the for vestibulocochlear function, especially cochlear part initially, then vestibular part. If we add this drug with that of the loop diuretic, then certainly there will be ototoxicity that will be manifested very quickly. Okay, we got that. Now we'll go to number 8. Which of the following diuretic have been widely used in the treatment of hypertension, especially mild or moderate type of hypertension? because of their ability to not only reduce blood volume. If there is reduction in blood volume, then there will be reduction in cardiac output. According to the Frank-Starling law, less cardiac output, less force of contraction against resistance. So there will be decrease in blood pressure. So this diuretic not only decreases the blood volume but also dilates the arteriole. Arteriole are the sites of peripheral resistance. Okay, they have smooth muscle in their wall. So these are the sites of peripheral resistance. If that diuretic can dilate that arteriole, certainly there will be even decrease in peripheral resistance, decrease in cardiac output, decrease in peripheral resistance, and our diuretic is the thiazide diuretic. It may be hydrochlorothiazide, okay? It may be just chlorothiazide, okay? That is the drug, or thiazide like other drugs, okay? We got that. So number 9, a 72-year-old man with history of long-standing heart disease had developed respiratory distress, was brought to the hospital emergency department by his son. On examination, the attending physician diagnosed pulmonary edema. Okay, pulmonary edema is a serious condition. It is a crisis. So physician should use the maximum effective diuretics or the strongest diuretics. Which of the following diuretic was indicated in this scenario? Answer should be furosemide, number 9. That is the strongest of all of these in terms of the management of the pulmonary edema. Okay, this person has respiratory distress because he has pulmonary edema. Okay. Number 10, a diuretic is completely absorbed by taking mouth in the upper part of the small intestine, strongly bound to protein. Once it is in the blood, it should be strongly bound to the protein. Okay, rapidly converted to canrenon, which has mineralocorticoid-blocking activity. Which of the following diuretic fulfill this criteria? So strongly, it is very quickly absorbed, strongly bound to the protein, converted into canrenin, and it is mineralocorticoid blocking. It has mineralocorticoid blocking activity. So our answer should be spironolactone. Okay, this is the drug. Okay, so this is the drug spironolactone in the management of in the criteria of this diuretic. Our answer should be spironolactone. Okay, so we got all 10 questions. So if you like my video, please support my channel, please subscribe me, and once you have done these questions with me, please open the textbook, confirm from the textbook, and we have one more slide for the answers. So don't forget to solve that. Please read all the questions, try to answer by yourself first, open the textbook, then confirm from the textbook the answers. All the answers are here. So I wish everyone have a good day and have a nice day. Please support my channel. Please subscribe me. So thank you very much. Okay, take care now.